Hi, we're at ID Week 2015 and I'm here with Dr. Chip Chambers from University of California, San Francisco. I went to your talk actually about resisting resistance, but could you tell us a little bit about how resistance develops?
It is an inevitable consequence of the use and abuse of antibiotics. At any point during an antibiotic exposure of an organism, there's going to be a time when the antibiotic concentration falls below that of an organism which is able to survive, and then you've then selected for survival of that organism.
So it's kind of like when someone is prescribed antibiotics and they don't take it as prescribed, or they take it when they don't need it, it'll cause a problem. So all of these effects build over time.
But as you know from the microbiome, there are thousands, tens of thousands of off-target organisms that are also exposed.
Right.
So you're not just enriching the bacteria, you're enriching the gene pool across a broad range of bacteria.
So what are the tools that we have right now to combat resistance?
We know that half of the antibiotic use is inappropriate,
Right.
just on the face of it. Then a considerable portion of antibiotics usage is overly broad, too long, too many. Antibiotics seem like they're simple to order and to prescribe. I think people don't appreciate the downside. Antibiotics are the only drug class, however, pretty sure this is true, where if I prescribe a drug to you, I may affect what happens to your roommate in the hospital bed. One of the more effective approaches is to teach doctors how to explain to their patients in a way that convinces the patient of why you do not need an antibiotic even though you think you do. I mean, from the patient's point of view, they do not go to the doctor to be told they don't need an antibiotic, right? They're going to the doctor because they think they do.
Yeah.
So how do you get them, do you spend 30 minutes trying to convince them they don't need an antibiotic or write a prescription for penicillin?
Exactly.
It boils down to that simple of an interaction difference.
What other challenges do you foresee in the future with resistance?
More of it. This is a global problem, and it is transportable. So what we're experiencing now, we're a very developed country. We have access to all the latest technology and drugs, but this will not protect us forever from a rising tide of resistance worldwide.
So I guess we have to expand our antimicrobial stewardship efforts like globally.
Antibiotics are tremendously undervalued in terms of being life-saving. You know, we sweat over the fact that a course of antibiotics will cost $1,000. But in the grand scheme of things, that is a drop in the bucket for something that can save someone's life. So I think there's a mistaken valuation.
Yeah. Well, thank you so much for your time. I really enjoyed talking
You're welcome.
to you.
It's a pleasure to meet you too.